wearing non-medical masks has always been a protecting others from if you're infected. So it's always you protecting others. And so at the beginning, it was about people who have symptoms, who should wear a mask. If you say in the home setting, on an airplane, if you found someone who is sick or going, you have to go to the clinic or something, then the sick person should wear the mask. Now here, you're considering, if you think about it, if you're in a community where there is actual transmission of the virus, just consider everybody as potentially being that sick patient, because you can't actually tell, right? So that's the change. Is asymptomatic people could potentially be infected or potentially transmit. Again, you're using that covering to protect others. So that concept is the same all the way through. I think from certain public opinion research, etc., Canadians are wearing more masks, and they are more, the social cultural shift is beginning to occur. So part of what public health is doing is, the concept is one, I think, of reciprocal protection. So I think for Canadians, thinking of it as I'm protecting you and you're protecting me is a very key concept. We have to gain the trust of the Canadian public and get their buy-in to do all of this. Mandating is one measure, which some jurisdictions might take if they have to. But for the most part, I do think that the shift is occurring in the population as well, which I think is great.
Obviously, everyone's situation will be different, and we always need to pay attention to public health authorities. When it is possible for me to keep 2 meters distance from people, that is what I prefer to do. In situations where I'm either walking through the halls of Parliament or going to my office and coming in proximity to people, I've chosen to start wearing a mask. That's my personal choice. That is aligned, I think, with what public health is recommending. I think we all need to adjust to what works in our circumstances and keep safety at the forefront of what we're doing.